I work here in the NICU, and I am a nurse that takes care of patients and also works in patient family education and nursing education. I help with, especially with this patient population, helping families get home when their baby has some extra learning needs when they're going home. Chronic lung disease is also called bronchopulmonary dysplasia. It is the most common complication of prematurity in infants, especially premature infants weighing less than 2 pounds and being born at less than 28 weeks gestation. Chronic lung disease affects about 10,000 to 15,000 infants every year. Infants with chronic lung disease are at risk of having to go home with a nasal cannula and even sometimes mechanical ventilation. Baby is diagnosed with chronic lung disease if they are still requiring oxygen support at 36 weeks corrected gestational age. The reason the diagnosis is made at this time is because usually by that time the baby is not needing oxygen support anymore. So if they're still needing it at 36 weeks, we'll make the diagnosis of chronic lung disease. The greater the need for respiratory support, the higher the severity of chronic lung disease. If the baby is corrected to 36 weeks gestational age and is not on respiratory support and is breathing room air, then the baby does not have chronic lung disease. These premature infants are more vulnerable to need higher degrees of oxygen support and possibly mechanical ventilation for extended periods of time. Your OB and after your baby is born, your NICU team work tirelessly to try and reduce the risk of chronic lung disease for your baby.
Hi, I am John Buckheit, and I am a neonatologist here at East Tennessee Children's Hospital. What does a baby with chronic lung disease look like? Because chronic lung disease affects the lungs, most babies present with rapid breathing, also called tachypnea. While babies without chronic lung disease typically breathe 40 to 60 breaths each minute, babies with chronic lung disease can commonly breathe 70 to 100 times each minute. The baby with chronic lung disease may also look like they are having a hard time taking a breath. When a baby is having trouble breathing, it may look like the muscles in their rib cage and between the ribs are contracting or pulling in each time they take a breath. The medical term for this that you will hear us use is retractions. When your baby's doctor or nurse listens to your baby's breathing, they may hear rattling sounds called rowels or whistling sounds called wheezing with each breath. An x-ray of the baby's chest may show white fluffy areas instead of clear, dark, air-filled areas as we should see. To help babies who are having trouble breathing, we use several different types of equipment in the NICU. One is called a nasal cannula, which gives oxygen into the nose through a small tube to assist the baby with breathing. Another type of equipment is called CPAP, which uses a hose connected to a nose piece, which gives air and constant pressure throughout the baby's breathing. Sometimes this CPAP is connected to a machine, which gives a breath in addition to the air and pressure. A third mode of respiratory support is called a ventilator, which gives air and oxygen through a tube that has been inserted to the windpipe, and the air then goes throughout the baby's lungs. Most babies with chronic lung disease will slowly improve over time, weeks to months, and gradually grow out of the breathing problem that they are experiencing. But during that period, they're at higher risk for problems related to infections or any associated issues with the lungs. This can be called pneumonia or bronchiolitis. If these babies get an infection, they tend to get sicker than other children do. Ordinary coughs or colds may make them wheeze or struggle to breathe more than a baby without chronic lung disease would experience. Some babies with chronic lung disease can develop high blood pressure in their lungs, which we call pulmonary hypertension. This condition needs regular follow-up from a pulmonologist or a pediatric cardiologist to make sure that the babies are receiving the appropriate treatment. These babies are also at higher risk for developing asthma as they grow, which is another reason that follow-up with a pediatric pulmonologist is important throughout their early childhood. Infants with chronic lung disease may grow more slowly than other babies and may even lose weight during an ongoing illness. Receiving the correct nutrition is very important for these babies to make sure they have adequate calories to grow while not overloading their lungs with fluid. Chronic lung disease is not a condition that ends when your baby's NICU stay is over. Infants with mild to moderate chronic lung disease will experience the most difficulty with their breathing during early infancy and childhood, with the majority of their symptoms resolving by the age of 2 to 3 years, and hopefully treatment for this condition resolving by the time they are 5 years old. However, their lungs may not grow and develop normally during this period of time, which can lead to problems with their breathing later on in life. Again, this is another important reason for them to be followed closely by a pediatric pulmonologist throughout their early years of life. These regular checkups allow for timely vaccinations, which are so critical for these babies. And if other issues arise, those can be addressed as well.
Hopefully all this information has been helpful for you to learn a little bit more about what's going on with your baby. But when you have more questions, please contact your NICU team.